Okay, so I lied. Give me 15 seconds.
Okay.
All right, we're live.
Okay, thank you. Good. Well, I think we're still expecting a few other folks, but I do need to announce that we're being live streamed and the meeting's being recorded. So I'll call the meeting to order. I think you've all gotten the agenda. Is there anything else anyone wants to make sure is on the agenda tonight? All right. All right, so let's look at the minutes from November. Can I have a motion to approve them? I'm sorry, I missed, there were a couple of hands. Jan, so, and a second? Larry, and any discussion about the minutes? Okay, so all in favor of approving the November minutes?
Aye.
Okay, so they are approved. Thanks, everybody. All right, so we have a few absences tonight, just so everyone knows. Dr. Duplan, Kaki, and Suli aren't going to be able to make it tonight. So as far as my report, I just wanted to let everyone know that Tom Lippa has resigned from the board and the substance use subcommittee. I just wanted to take a minute and publicly thank him for his service and what he has contributed over the years. It's really been helpful to have him part of the discussion and for him to bring the experience he's had to our discussions. So I want to thank him for all he's contributed.
Did he give a reason?
I think it was a personal reason. Stu may be able to, I anticipate Stu coming to the meeting for the agenda topic later in the meeting. So I don't know if he has anything more to share, but my understanding was that Tom thought it was time. And
okay.
So that's what I have heard. So. All right, and the other thing I just wanted to mention, I know some of you have picked up your thank you bags from the mental health department, and there's still some that haven't been picked up. So I'm going to take a little drive tomorrow and deliver them to your homes and just drop them off. And
Santa Mary.
You'll hardly know I've been there. I'll just drop it off and at your front door, and you can enjoy that when they come. But
you can drop it at my work, would probably be a lot shorter.
Okay, I'll just do that, Jan. Thanks. Yeah.
And Mary, I'm going to be at DeWitt Middle School tomorrow, so if that's easier than South Hill, that's where I'll be.
All right. Okay, I'll keep that in mind. But we wanted to make sure you all had those and know that we thank you for all that you do for the board and the subcommittees that you're on.
I can't
Thanks for
believe
the lovely gesture.
Pardon me?
I can't believe I forgot that somebody had a present for me. I should have been down there like in 2 seconds to get it.
Well, you don't have to wait much longer, Larry. It's coming.
Okay. I won't be able to sleep tonight.
All right. Well, I'll try to make yours the first stop then. So
Thank you, Mary. That's very generous of you. Thank you.
Oh, you're welcome. Sure.
Should we leave milk and cookies for you, Mary?
Ah, yes.
I would not object. That's fine. So
Coffee and chocolate, Paula.
that always works. Good.
Chocolate covered in strawberries.
Yeah, Paula. Yeah, that's another downside of our virtual meetings, the delicious treats from Paula. That's right. All right. So Frank mentioned to me before the meeting started that Harmony isn't going to be able to make it tonight. So She has a family emergency she has to deal with. So Frank is going to do double duty and give the commissioner's report and the deputy's report. So I'll turn it over to him.
Great, thanks, Mary. Just a few things to update folks on. Wanted to share a little bit about COVID if folks are interested. Obviously, things have been kind of changing over the last few weeks. Our case numbers are up pretty high. Much of it is now attributable to the Thanksgiving travel. Our higher ed students, we're starting to see more cases in that group related to their travel. They're still not the predominant driver of cases. It is community-based. We're not seeing large clusters outside of households. The household transmission is still the primary route that we're able to identify, but most of the cases outside of those are unidentifiable in that we don't know where the transmission came from. So really what that says is COVID is in the community. We knew that. We knew with the winter season coming that was probably going to happen. Quite frankly, there's not a lot of public health measures in place anymore, other than getting vaccinated, of course, which we still encourage everybody to do. And we are still recommending that masks be worn indoors for everyone in Tompkins County. But beyond that, life is kind of getting closer back to normal. And so we would imagine that there would be more transmission in the community because of that. The good news, our hospitalizations have still remained in single digits. So that's really, what we've been focused on is the severity of illness at this point. We're going to be reporting out a bit more data on that tomorrow for the legislature. So we don't have it all pulled together yet, or I'd share it with you and give you a preview. But if you're interested, there'll be more data after tomorrow's legislature meeting on some of that. We've been spending a lot of time on vaccines. Primarily the 5 to 11-year-olds. So we were able to vaccinate 2,300 5 to 11-year-olds through the mall before Thanksgiving. And Friday we'll complete the second dose for all of those. So we are at almost 37% of our 5 to 11-year-olds having a second dose on board, which is good news for that population. Booster doses, we are we had been doing some booster doses and then we had to stop in order to focus on the 5 to 11-year-olds. We are planning a large scale booster clinic for Saturday, this coming Saturday, December 11th at the mall. We still have all the equipment there from the children and the setup. So it worked for us to be able to squeeze that in. My hope is we're going to be able to offer about 1,000 to maybe 1,200 appointments on Saturday, which we're hoping will help with some of the backlog, because we know that finding appointments for booster doses is challenging, particularly in Tompkins County. It will be a Moderna clinic, but you can get boosted with any of the 3 approved vaccines. It is for only individuals that are over 18. We're working on figuring out how we can also do the immunocompromised 3rd doses at that same clinic. So I'm hopeful we'll be doing both Moderna boosters and immunocompromised Moderna 3rd shots. So more information will be coming out about that in the next day or so as we put the finishing touches on the logistics. Jan, did you have a question?
Just wanted to ask if it's by appointment or walk-in.
Yeah, we'll be by appointment only. So we'll be putting out a press release and the link will be on our website for folks to register. If we don't fill all the slots, then we will push for walk-in availability. But because we have, it's hard to say limited capacity when we're proposing to do 1,200 people, but we are limited with a maximum that we'd be able to do. So we start with appointments, and then if they don't fill, we'll push that we can take walk-ins.
Thank you.
Sure. There are appointments available around us in some of the surrounding counties. I think that is actually a good sign because I think demand here is higher than some other places. And so our appointments have filled up, which is a good sign because people are seeking their booster. But if someone is, really interested, they're generally in Broome, Chemung, even Cortland, you can usually find appointments within a week or so to get vaccinated if you're able to drive. But this will be something local. Paula?
Frank, have the demographics changed at all for those who are being hospitalized?
Not since the last time we reported them. Generally speaking, if they're hospitalized and they're under 70, they're unvaccinated individuals, and that has remained pretty consistent. We've had some younger folks in the 10 to 18 range, I believe, 2 or 3 that have been in the hospital. That'll be reported in this next report. So it is still a risk, and in particular for those over 70, even if they're fully vaxxed, they can end up in the hospital. So that's why it's so important for the rest of us to get vaccinated and take the measures to limit exposures for those most at risk. Larry?
What about boosters for people who are homebound?
Yeah, so we've gotten that question. It's likely just from a capacity perspective to be January before we're able to start to do that. We know the people that we gave the first dose to so it was Johnson & Johnson, the ones we did. So they received the first dose. We know who they are. We will be reaching out to them to see about a booster dose, but just with a capacity of trying to do booster doses and trying to do the 5 to 11-year-olds and dealing with the holidays and needing to give people at least some break in all of this. The homebound are the most resource intensive for us to get to. So we are planning for them, but it's likely going to be early January before we're able to start doing those.
Okay, well, if you can do anything more quickly, that would be great, but I understand. Thanks for updating us.
Sure. All right. So I think that's all that I had on COVID. Does anyone have any other COVID questions? All right. So moving on to mental health, substance use, developmental disabilities type issues. Harmony was going to report tonight that she's working on getting all the contracts updated for next year. Harmony's actually been doing a great job of reformatting the contract, the part of the contract about what it is you're supposed to be doing, and trying to streamline that and make it similar from organization to organization. So that way we'll get to a place where we're going to be able to report to you all more regularly their progress towards the deliverables in the contract. We've been talking about this, I think, since I started in this role, and you guys probably were talking about it even before me. But Harmony has really done a great job of trying to reorganize and help our contractees better understand what the funding is aligned for and how to report that to us. So I think they've been appreciative of having that clarity. So she's been doing a lot of work on that front, and I think it's going to end up paying off for us in the long run as we review the contracts. There's been conversation going on around public safety reform too. Harmony was part of I'm going to call it a town hall because that's what we call them. I'm not sure what they called it. But she was there with, I believe, with the chief and the sheriff and under sheriff, and just talking about the mental health response as it currently exists. Because I think there's been a lot of confusion and maybe expectation from the community about what mobile crisis can do and what it actually is. And so she did a really good job of presenting that. I think there was some good conversation with the community members that participated. We have also been talking with law enforcement leadership and trying to better coordinate our work together, again, as it currently exists, so that there's good communication. Things aren't perfect. I think we can all admit that. But we're working to try to improve on where we are, and are very much looking forward to the continued conversations about, what the expanded public safety reform conversation will bring for the services that we're a part of and the people that we serve. So still a lot of work going on there. I believe they announced today the new director of the Community Justice Center that's been created, that's going to kind of lead this process. And I apologize, I don't have the name in front of me, but that's good news, because she'll be coming on board and then looking to hire the other staff that'll be part of that. And just so you know, they are actually going to be housed in the mental health building. So they're going to be on the second floor of our building, using some of the old home health homes. There it is. I got there. Sorry. The old health home space. And so it's good. I think it's good because hopefully we'll be able to influence, right? Because just by proximity, we'll have opportunities to talk to them, understand the work that they're doing, and hopefully, be a big part of the conversation as that moves forward. So lots of exciting stuff going on in that front. Some less exciting news, we are struggling with staffing at the department. I think, as most healthcare entities are, we have some retirements. We have some folks that are leaving for new positions. So we are actively recruiting. We are working with HR to try to adjust. We're going to have a new job title. So the psychiatric social worker is going to be called a licensed clinical professional, I think. And it includes now all of the licenses that are authorized for us to use. So it's not so restrictive. And we're also trying to shift it from a written exam. So civil service, as you may know, still uses written exams for scoring for eligibility for the positions. We're hoping to shift that to training and education, which is what we do with the nursing positions. It's still an exam per se, but it's an exam where HR looks at their training and experience and gives them a score that way, which we're hoping will help, because if you have multiple options for employment and one of them requires you to take a test to see if maybe you'll be eligible for that position, I know which position I would take, and it wouldn't be that one. So we're trying to create some flexibility wherever we can to be more competitive with the market. I will tell you that we took our nurse practitioner job title, of which we currently have one person in that title, psychiatric nurse practitioner, and had the salary redlined, which essentially means we're going to be paying that position more than what is in the stated salary scale, just because the market had driven up and we were at risk of losing our current psychiatric nurse practitioner. The legislature was willing, and well, they haven't yet. They'll do it tomorrow, but it's been through two committees. So hopefully tomorrow that'll be fully approved. It will also redline the vacant nurse practitioner position that we have. So as soon as that approval occurs, we will get it advertised with the new salary in hopes of attracting another psychiatric nurse practitioner. So all of this is ongoing. We're actively looking for new help. And at the same time, we're also preparing for a scaling back potential on services that might need to occur when these retirements and departures take effect throughout the month of December. So we're removing people from our caseload that are eligible and ready to be discharged. We're redistributing the casework from the folks that aren't here. I will also say we have we have a psychiatric social worker and a community mental health nurse that are on medical leave as well, whose caseloads we're trying to cover. So we're doing everything we can to shift to get to the core people that we have, but there may be a time frame where our admits need to be reduced in order for us to keep up with the caseloads until we get some of those folks back from medical leave and some of these positions filled. It's not ideal, But what we don't want to do is be bringing people into care and then not being able to provide them service. We want them to be looking other places and hopefully can find another community partner that can serve them in the interim. We will always take crisis. So there will be crisis spaces kept with the team, the mobile crisis team, taking those crisis calls. And we also have to take hospital discharges. So we will, of course, take those. So for those folks that are in crisis, we will make sure that they get seen and get into service if need be. But for general intakes, we're likely going to have to scale back a bit beginning towards the end of December and into January until we can get some of those positions filled. So it's not great news. We're expecting that it will be short-lived, but we are trying to be proactive and plan for this. One, because we want to be fair to our clients so they can know what the expectations are. We also need to be fair to our staff who are already overstressed and overburdened, that they're not going to be expected to take the brunt of having several vacant positions in the department, because our fear is we'll lose even more of them. So it's a balancing act. And I can tell you, Harmony, Jeremy, Susan Spicer, Dr. Lippert, and the seniors in the clinic have been working very hard to make sure that we can provide the most care in the most effective manner possible as we go forward. But just wanted you guys to be aware that that's kind of where we are with the clinic right now. And I'll stop there, Mary, and happy to answer any questions anyone has.
Larry?
Is Family and Children's experiencing a similar issue around competition for, are people leaving because, there are other and better jobs? From
Yeah, I mean, I wouldn't want to speak for Family and Children's. I think they've also been creative in both recruitment and retention as well, trying to maintain their workforce. I know I can say that they believe that there isn't enough workforce to meet the demand. We meet I think we meet once a month now with all of the mental health and substance use providers, and that's been the running theme for half a year now. They're in the community as a whole. I don't think there's enough resource to meet the demand, and each agency is kind of facing that.
I've heard that telehealth companies are pretty aggressively recruiting too.
Yeah, we've lost some folks to telehealth. Quite frankly, they can work at home for their whole shift, they can just work from home. And that's unfortunately not something we're able to offer. We are allowing people to work from home, but OMH requires us to have under our license availability for 50% in-person services. So because we're a licensed clinic, we have that requirement that we have to meet, which makes it difficult to give any one person the ability to just work from home and have it be equitable across the workforce. So as it is, we're trying to give people 2 to 3 days a week to work from home telemedicine, but that's not 5 days a week, which other employers can offer. So it is a competitive, you all know it's a competitive work environment, right? Or recruitment environment right now. And so we're doing everything we can to try to be as flexible and support people's needs. But, because we are a licensed clinic, we have some requirements that others might not. Larry, do you have another question?
I remembered the second question I had, which is, do you have any, I noticed a couple of weeks ago that Suicide Prevention and Crisis Service was advertising for an executive director. Do you have any update or know anything about where that process is?
Yeah, I don't. Harmony has been our liaison to suicide prevention and crisis. She probably has a bit more detail, but we have been communicating with them, and I do think they recognize the importance of having a new executive director on for the future of their organization. There's a lot changing in the crisis line world with 988 coming along, and I think they recognize that having been without an executive director for this length of time has really been a challenge for them. So I know they're trying. I don't know the status of the search at the moment, though. I'm sorry.
Frank, could you speak a bit about how the merger activities are going?
Sure. Yeah. So it's kind of crazy that they're still happening. In the midst of everything else going on, we have a team that has had some capacity to be able to continue to meet, and those are the integration side of things, and looking at the new name and what the organization might be called. They've been doing work. They've been talking with some consultants. I think they're close to having an RFP to put out to bring somebody on board to help us navigate that process a bit. So that work continues. The other committee that was looking more at kind of the integration of services had put on pause because most of those people were directly involved in COVID work and or dealing with the mental health staffing shortfalls. They're getting closer to starting up. I think they're going to meet again in the next week or two. So those conversations will begin again. So even in the midst of all of this, those two teams are still out there working away on those two priority issues. On the admin front, that continues in more earnest. I think I've said before, in one instance, the departures through early retirement and people leaving, it actually became a benefit to us because we were able to do the kind of merging of admin together of the two departments more rapidly because we had vacant positions to convert over to the things that we were hoping to do. So Jeremy is working with Brenda Crosby to kind of bring those things together. Karen Johnson, who's been a longtime administrative coordinator for the health department that did all of our state aid and budgeting work, has been promoted into the financial coordinator or administrator. I don't remember what the title exactly was, but so she's now spending more time down at mental health, learning the state aid and budgeting things on that side of it. So that's really giving Jeremy some breathing room to kind of think about the more big picture things that we had hoped that his position would ultimately be doing. We're also recruiting and hiring into some of the senior account clerk, typist, and administrative assistant titles that will round out that admin team. Jeremy and the group did hire another billing person that I believe either just started or will be starting at the beginning of the next pay period. So that's going to bring that billing team that we were talking about building that does billing for both places. They're going to be complete and have the full 3 positions that we imagined for that. So that work is continuing and really making some good progress. Again, the admin piece, the goal is to be able to have our 2023 budget be in a joint chart of accounts, which means it has to be done and ready to go by mid-2022 for the budget process that unfolds in the second half of the year. So they are actively working and planning towards those conversations to have those to have that work in place in time for that 2023 budget.
Just a couple of other things. Is there anything to report on the pharmacy idea that we talked about a few months ago? I know that was being explored further.
Yeah, they're still, I think they're looking at the RFP right now because we do feel like it needs to be RFP'd. To be honest with you, it has stalled a little bit because Jeremy and Harmony have been working on this staffing issue and it's really pulled a lot of their time and energy away. We are still very interested in doing it. We just have to get the time to get the RFP together and be able to get that out and move forward.
Thanks. Any other questions for Frank? Jan?
I was just curious, can you describe briefly what Jeremy's position is? I just recall it being finance for both health department and mental health department, but I hear his name a lot, so it seems like he has a more expansive role than that. So
Yeah,
I'd
yeah,
like
that's a good question, Jan. Yep. So Jeremy Porter is the fiscal administrator, I believe is his title, and Karen Johnson's a fiscal coordinator. What we imagined for Jeremy's position is that it would be the fiscal administrator for the joint department. Brenda Crosby at the health department, her title is public health administrator, but her position in this new joined department was more of a deputy public health director, moving out of the financial part and more into the oversight of the public health work being done versus just doing budget, state aid and such. So what we're doing is we're transitioning much of the financial work that Brenda was doing becomes Jeremy's. And Brenda's position is morphing into that more deputy public health director type title, similar to what Harmony does as the deputy mental health commissioner. His main role is to be that senior level fiscal person for the joint department. So really not in the day-to-day work of paying bills, doing budgeting or state aid, but being the strategic leader for all of those efforts, our billing, our electronic health record, our budget, our state aid that comes in, contracting, all of those things. So just as we have deputies in both places that are kind of looking strategically at the service-oriented side of the shop, his position is looking at the admin functions, the budget, the financials, and being that strategic leader for that group. Did that help?
Yeah, that does help. Thank you.
Yeah, and if you haven't met Jeremy, we should rectify that. Quite frankly, I don't know that we would have gotten through COVID at mental health without Jeremy. We were without a deputy for a good bit of time, and obviously, I was not able to give as much time and attention. So Jeremy was leading the department and did an amazing job carrying us forward. And now having Harmony there, who's amazing as well, the two of them teamed up with Dr. Lippert we have the right people in those roles now, and I'm really excited for the future. And you should know who those folks are, because they are what keeps things moving. And I'll make sure that we can get them introduced, and you guys have more FaceTime with them.
Thanks. Any other questions? All right. Well, thanks, Frank, for all those updates.
Sure.
So moving on to a presentation from Elise. She's graciously agreed to do that. We had learned that there's some new information regarding employment services. And given some of our planning and for employment services in the community, we want to make sure that we're staying as current on that information as possible. So, so I'll turn things over to Elise to share that information with us.
Sure. I mean, I didn't prepare too much of a presentation, so don't be disappointed. But yeah, it's a pretty straightforward executive order. And I think, Mary and Jan and perhaps others were thinking it might be useful to just have a quick overview of the executive order in relation to some of the conversations we've had lately about employment. But so the executive order, it addresses the issue of wages among federal contractors and subcontractors. So it raises the minimum wage for people who work on those contracts or on those subcontracts to $15 an hour, and explicitly includes employers who have 14C certificates from the Department of Labor, which would allow them to have paid sub-minimum wages to people with disabilities. So in Tompkins County, it's not quite as impactful because Challenge itself, and which is our primary employment provider, in their workshop did not have, in recent memory at any rate, federal contracts. Mosaic, however, has many of these subawards through Source America, the Ability One Commission. So I'm not sure. I think that Briggs Seekins had told the Developmental Disability Subcommittee not that long ago that there was no one making less than the minimum wage on those contracts for Mosaic. So it would probably result in a raise, certainly, for those individuals. But I do believe they are all working out of county. What needs to be, remains to be seen is, so the definition of the law applies to people who are performing the work of the contract. And there's usually some nuance to that. So for example, when you look at executive orders for federal contractors around vaccine mandates, there's some nuance to the definition of who could be considered to be performing the work of the contract. So that's probably, the devil is in the details there, in terms of whether, Challenge, for example, could be considered a federal subcontractor simply because Mosaic has subcontracts to do, the type of work that they are doing. It seems to me on a quick read, probably not. But again, they do report that they don't have anyone currently making less than the minimum wage, as far as I'm aware. So it's more impactful, I think, for places like J.M. Murray in Cortland County, where they have relied very heavily on those federal subcontracts over the years. And it's, and it's a good thing. I mean, it pushes wages up for everyone, right? Not just people with disabilities. So it puts more pressure on the $15 minimum. And in localities where there happens to be, if there happens to be a minimum wage that's greater than $15 an hour, that the local minimum wage will prevail, and it's chained to the CPI. So as the consumer price index increases, the wage will be reevaluated every year. And so that's pretty much it in a nutshell. I think a lot of providers saw this coming for a very long time, so it shouldn't be, they should have seen it coming. So it shouldn't be a shock. Hopefully they have prepared. I don't think it will be as impactful to people in Tompkins County, but in other counties, it remains to be seen if individuals will see less work as a result, just because they're trying to balance things like, benefits and wage and earnings or the agency is trying to manage expenses. So I don't know. And, with work like that, there's really two issues. So the first is wage. The second is setting. So any executive orders or legislation aimed at fixing the subminimum wage problem is doing so parallel to any effort to change the settings rules around that type of employment, making sure that folks have opportunities for competitive integrated employment. But it's a positive any way you look at it, I think. Yeah, Larry.
Do you have any sense of whether this might affect the merger between Challenge and Mosaic?
No, I don't believe so. I think that ship has sailed. I think they are, in partnership, I guess they would say. And I don't, without knowing too much about Mosaic and how many people they have working on these contracts, it's hard to say.
Okay, just a thought. I think this is great. Of course, the problem with executive orders is they expire or could expire when the new presidential administration comes in, and so I assume there's also a parallel work happening to have Congress put something in place. So that
Always, yeah.
Yeah.
I think there's always something, something in the works. I mean, there's constantly efforts to amend the Fair Labor Standards Act to get rid of 14C. There are different pieces of legislation that have been kicking around the House for a long time. There's state-led efforts. Just so far, nothing has really come together that comprehensively to a piece of legislation that would amend the Fair Labor Standards Act, for example. But I think we'll see it. I think my prediction is we'll see it within the next 5 years, hopefully. And in terms of the executive order being rolled back, if this current administration has another 3 years, I would guess that by the time 3 years expires, especially with the current rate of inflation, a $15 minimum wage will seem pretty reasonable. So no one will be interested in rolling it back by then.
Hope not.
Yeah.
Depending on who, anyway.
Yeah, I mean, it would be a pretty regressive policy. So my guess is, you never know, but my guess is that will remain.
I actually have a quick question. Are there any concerns in regards to that wage perhaps damaging people's efforts to get social services?
Well, I think that's always a very individual calculation. And Jan could speak to this better than I, but one of the issues we do have in Tompkins County right now is a lack of available certified benefits planners. So everybody has their own personal calculus in that regard. So if a person, for example, has custody of children, that makes a difference in terms of what their earnings potential. I mean, I knew lots of folks who would try to keep their earnings under a certain limit because they would lose their childcare subsidy, for example. So it's really difficult to say. I think the most critical piece is making sure that people have access to a person that they can sit down with who is expert and understands their personal circumstances. Jan, did you want to say something about that?
Well, yeah, I can just add that as far as I know, the certified benefits counselor is one at Flick, one or two at Challenge, and one at Workforce New York, maybe two. And Workforce New York will not take anyone that isn't, using their services. So in other words, if it's a person applying for Social Security disability or just needing some of this, they don't help them. Challenge will not work with anybody who isn't funded, who doesn't come with money attached. And so it's one of the steps in DSS is to have folks find out if they're eligible for SSI or SSID. And they're all coming to us, and one person can't handle that many people. So I've been trying to talk to, without much success so far, talking to Workforce New York and Challenge. Challenge is taking a really hard line about if it doesn't have money attached to it, we don't do it. And then I wanted to also reach out to social services and just see what they're thinking. If they had one person trained in that or certified or even trained in being able to help people apply, that would make a big difference. But it is a problem. I mean, there's a lot of people that need that help, and it's critical.
One of the things, and I'm going to forget what the acronym stands for, but the Department of Labor is starting a new initiative that they call SCION, SCION, and they're using some funds at the state level to invest in disability employment initiatives in all 33 workforce development regions across the state. And previously there had been a federal grant. I think that New York received, I can't even remember how many rounds, Jan, maybe you remember, but at least like 5 or 6 rounds of that federal funding, where they had disability resource coordinators who were benefits experts and certified benefits planners in some workforce development regions. So that money went away this year. And so the state decided they thought the program was worthwhile investing in. And so now they're expanding what was being done under that federal pot of money into all 33 regions. And so that should include training more people to be certified benefits planners. I know because I've been in talks with some folks from the Department of Labor about their intention to do that. So, so that might help and to be continued, but I can certainly get more information from Alan Gallagher at the Department of Labor about that and see where they're headed in terms of training more benefits advisors.
And just to mention, virtually none of the people that come to us seeking benefits advisement are attached to any funding source. So we're just doing it under our basic IL contract, but it costs money to get someone certified, the training, the time they spend studying and so on. So it's just, and just in general, you know, everybody else is turning them away because they can't make money. And yet we've got all these people. It's really frustrating. I mean, we want to help them, but
Yeah.
Access won't pay for benefits advisement, and you know, same old story.
Yeah, which I believe, don't quote me, but it's somewhere between 1% and 3% of VR recipients are currently receiving benefits advisement. So it's a really low number and it should be much higher. So VRs really should be paying for that as a service. But anyway, digress. So we'll talk about that.
Yeah, I could talk about that all day too.
Yeah, well, yeah. And
Wouldn't change anything.
Any other questions for Elise? Okay, well, thank you so much. That's good for us to be aware of. Great. All right. Stu, could I turn to you to give us an update on the nominating committee and activities there? I think you're on mute there.
Testing 1, 2, 3. You can hear me now?
Yeah.
Okay. I would say, generally speaking, another busy year for our committee. One that going back a number of years hasn't been too much work doing, but we have 4 of us working hard during the entire year trying to fill up spots. The first thing I wanted to be able to suggest is that maybe we go into executive session to discuss some of these applications. So would that be at this time an appropriate way to go?
I'm wondering if you wanted to give a little bit more background, maybe how many openings we have
Sure.
currently, and we could start with that.
Yeah, we have openings in every one of the committees as well as the board. In substance use, we have 3, mental health 2, DD 2, and community service board. We have 2 openings. We have also some folks that are going to be renewing their board commitments, as well as the subcommittees that they have been on as well. 2 are myself on the community service board and substance use, 2 with Mary being on the community service board and the mental health committee. I believe Khaki has a renewal on the community service board that we will need to vote on. And I got an email saying that Dr. DuPont needs a renewal, but I do not have a resignate advisory board application for him. So I don't know if Karen, you have one. I just didn't get it.
I believe Karen does have one. Yeah.
Okay, so we'll put his name on the list to try and recertify him. My understanding is the community service board. I don't think he's on any other committees.
Right.
And then we will also have our slate, which, as you can recall, we need to present the slate and have the board be knowledgeable of that slate 30 days before the voting on that. So I think our next board meeting will be in January 3rd, 4th, or whatever it is. We counted it and it was 30 days. So I don't know if you want me to present the slate now or discuss more of that in executive session, Mary?
I think you could present it and then we could go into executive session.
Okay. Edification, those who are presented to the slate, we nominate the chair and the vice chair. It's a 2-year term. The vice chair has knowledge that when the 2 years are up of being vice chair, that person, if there's no other conflicts, will automatically be asked to chair the community service board. So, Mary, this looks like your last full meeting for you to chair. I want to thank you for all your work and commitment. You and I work well, nicely on a lot of different things over the years. We'll continue to work well, I'm sure, on the nominating committee. But the slate for the new chair will be Maria. You're blacked out. Are you there, Maria? I always call her by her first name because I have difficulty remembering how to pronounce it. Morg? How do I say it, Maria?
Yes, I am here, and my last name is Morog.
Morog, yeah.
Yes.
So the slate is Maria Morog for chair of the Community Service Board. She has been our vice chair for the last 2 years. And I believe we have an affirmative response from Alish to be the vice chair. Alish Switzer will be nominated for vice chair, and that will run for a 2-year term. So that's officially the slate being presented to the board.
Okay.
And I would like to talk about how to fill in some of the other availabilities. I know there was a time we had a real difficult time filling them, but one of Frank's people found it easier to post that, and we got a good response from that posting. Who's the person, Frank, that has been doing that?
Sam Hilson, I think, in health
Sam.
promotion.
Okay. I think we want to add a little addition to that kind of posting, and I think it's going to be up to the Community Service Board as to some of that wording. But we've looked for a variety of diversity, folks of color. Law enforcement has been popular. We lost one of our law enforcement people. We'd like to be able to replace them. We have feelers out, texts and emails to a variety of people that could fill that spot. I also wanted to hear from the Community Service Board as to their thoughts as to how the nominating committee should continue to proceed in trying to fill the vacancies as they come up. Right now, that has been the law enforcement folks call it diversity as one of the main guides to seek out folks who are interested in being on the board and the subcommittee. There's, I don't know if we need to go into executive session to be able to talk more about that, and also what has happened to our former chair of the Substance Use Committee. And well, briefly for the group's, the board's edification, the person has stepped down and taken charge of being the chair once again. And again, have no problem continuing to do that next year as well. It was a while before we can actually get somebody from the substance use to want to take the chair.
Jan, did you have a question there? Or a
What's
comment?
that?
I didn't have a question. I just wanted to add, because I don't believe this has to be an executive session, that one of our discussions has been around having people who have experienced either substance use issues or have developmental disabilities or intellectual disabilities, and people with mental health issues on at least the subcommittees, but I think the board would benefit from that too. We don't seem to have as much trouble with people who disclose that they have had mental health issues, but I think that the other two we need to pay attention to. That's just my opinion, and that's up for discussion, but I just wanted to make sure I mentioned it, particularly since last month, CACI mentioned in our bylaws that according to the current bylaws, which I know we're looking at revising them, and we haven't been following them perfectly, but it does say that we should have consumers on them. Consumers. of
Right.
service.
I think the term consumers catches most of what you were saying, Jan. And I think we've had mandates from the Community Service Board in the past to make sure we try to find as many consumers as possible. And I think we're kind of looking to renew that enthusiasm.
Mhm.
And I think that would also involve a different kind of recruitment and venue for advertising or for trying to recruit that type of, I shouldn't say that type of person, but people with those qualifications, because I don't think everybody reads the listserv.
Exactly. Yeah.
So-
And another piece that we've talked about is our own individual efforts to go out in the community and find such folks. Quick example, my wife works for school system, knows a lot of folks from that position, and then it's put it out there that Community Service Board and the substance and the subcommittees are looking for specifically folks of color, and some of the Afro-American leaders in our community so far have been happy to receive that information, although I haven't gotten any phone calls or texts or mails since that was discussed. But I think that kind of groundwork from not only me, but from others could be helpful in filling those positions with the kind of criteria we're looking for.
Mhm. Right.
I think one of the challenges is that every nonprofit and public board in the universe is trying to diversify their board.
Right.
And, so there's a lot of just sort of, it comes from a good place. So I don't mean to sound critical, but it's this sort of tokenism perception, like we're reaching out to these communities of color and saying, come on, join this board because we're lacking representation. And it's true and it's sincere. But when it's coming from everyone all at once, it may not necessarily feel all that genuine. And I think probably that might have to be built more around relationships, that people might already have community, and trying to sort of, work our relationships and our networks, people that we're more connected with.
Yeah, I think that's a good point. I think we also, when we bring new folks into our groups, I think we need to think about how do we support their participation and bringing people up to speed on all the background that might be useful so they can be as comfortable as possible. So another thing for us to think more about.
Yeah, we had this thing that lasted a very short period of time called, what was it, board buddies. That somebody new on the board would buddy up with somebody who's expertise, been on there for a while. I remember seeing it in the minutes, and it was listed in, I think, in the bylaws or a revision of it, but obviously it didn't go too far into creating that to be something that we were going to be doing time after time as a new person came in.
Mhm. Right.
And also I wasn't at the last board meeting, so I also have the application for Beth McGee, but Mayor, you informed me that the board did vote on that?
Correct. Yeah.
Okay, because I didn't see that in the minutes. I kind of glanced over that. That would have been an executive session.
Well, I think
Oh,
we
wait.
just at the end of the meeting. Yeah. Larry, did you have a?
Are we going in, is there an executive session coming up?
Yes, there is. Yeah, I think
Okay.
we will be discussing the reappointments. Okay. So Stu, you're looking for folks to share any additional suggestions, and so
Yeah, we have our slate, and we do that amongst ourselves. We reach out to as many board members as possible. We had plan A and B and C and D. Eventually it worked out, but just to give the board a little bit more awareness, you want to be on a certain committee, now's a good time for you to voice that. You want it to be a chair, or down the road a vice chair. Now's a time to talk about that. One of the policies that the nominating committee has been following is having kind of a non-repetition of board chair. So if you've been that before, try not to have you become that chair again. So go through the priority list of, okay, who's new, who do we think would want the job? We ask them. So most people who join the board can have an opportunity to be chair, but if that's something that you want to do sooner than later, that should be something to discuss either with the four of us on the nominating committee, or open session now, or you want to save that for executive session. Bottom line, we need to know what you'd like to do.
all right, so maybe we should go into executive session now and talk about the reappointments and any other thoughts about the slate that we've recommended here. So can I have a motion for
I will
that?
motion that we go into executive session.
Okay, Travis, second. So we are in executive session and Frank needs to do something.
Yeah,
So should we jump off then, Mary? Maria and I?
I don't think so.
Doesn't matter. You can talk about me to my face. It's okay.
all right, I'm
I'll
gonna
talk about you to your face, but I don't know about Maria. I don't think she's got to face that.
We don't have her